The opinions and views expressed on this program do not reflect those of the management or staff of Community Media of Staten Island.
Hello and welcome to RUMC Vital Signs. This episode we're talking heart health. In this episode, our leading cardiac expert will join us to discuss heart-related trends here on Staten Island. We'll introduce you to our new at-home cardiac rehabilitation program. We'll test what you really know about your heart in a fast-paced myth versus fact challenge. You'll get a sneak peek at the upcoming Joan and Bernikow Heart and Vascular Institute opening later this year. And we'll end with some quick expert tips to help you stay heart healthy. My guest is the chief of RUMC's Cardiovascular Department, Dr. Francesco Rotatori. Dr. Rotatori is board certified in 4 areas of cardiac care and has extensive training in many areas related to the cardiovascular system. He specializes in treating congestive heart failure, atrial fibrillation, coronary artery disease, heart attacks, and hypertension. He's been on the show before, so welcome back to the show, Dr. Rotatori.
Thank you, Alex. How are you?
Very good. Tell us a little bit about your background. What led you to a career in cardiology?
Sure. So my journey into medicine began in Italy, in Milan particularly. But even since I was born, my father being a cardiologist, I was always very familiar with the rhythm of the constant development of a job like being a cardiologist, and especially seeing how important is the impact that a doctor like a cardiologist can have in the community. That's what led me to this field. And subsequently, when I moved to the United States, I mean, in my search for the why behind medicine, I joined a research lab. I worked in basic science research for a couple of years, and then finally I decided to come back to the clinical work, and that's where I find my place in Staten Island.
And when it comes to cardiology, was there some people go into cardiology because they've had a family thing, or was it your dad being a cardiologist watching what he did that led you to this career?
Partially that. Again, partially, as I said, is the tremendous impact that you can have in the community with this job, and on the other hand, also the fact that cardiology is a field that has to do a lot with physiology, and that really always intrigued me a lot. So this heart, this little organ here, it's pretty amazing.
Yeah. How long have you been at RUMC?
Well, I've started in 2007 as a resident, so I've been there for a very long time, almost 20 years.
So in your time at RUMC, what are some of the cardiac trends that you've seen among Staten Islanders, good and bad, or what have you been seeing over the years?
Well, so to start, of course, Staten Island, I mean, and at RUMC, we see, I mean, it mimics pretty much what the general, I mean, population in the United States has. So the main issue like heart failure, heart attack, atrial fibrillation, those are typical disease that we see in the island. However, the island has some unique aspects, and unfortunately, we're not proud to say that these diseases are also more prevalent than elsewhere, and that probably has to do with what we call the risk factors. So we know that the disease that happens to the heart happens because of the slow effect that some of the risk factor can have in the vessel around the heart, in the valves in the heart, and so on. And those are like the common one, like diabetes, high blood pressure, high cholesterol, and in particular in Staten Island, also others like smoking, which is a rate that is higher than the other boroughs in New York, and what we call sedentary lifestyle. What means by that is that we are not active enough, we don't exercise enough, we don't move enough to reduce the risk of disease of the heart. And we can explain later a little bit why that happens. But
how has the field of cardiology changed, if at all, post-pandemic?
Well, it did change, although now it seems to be the kind of like we're starting to see the same rate of disease that we saw before. But during the pandemic, there was a very long period of time in which maybe because of the fear of the disease of the COVID-19 and so on and so forth, there was a lack of follow-up with patients with their doctor or so, and that kind of made the process of developing of disease of the heart faster. And so to make it short, we saw more people and sicker people after the pandemic.
Did COVID itself, I know there were studies that COVID actually did affect the heart itself. Is that true?
True, yes, it's true. The COVID-19 has been proven to have a particular, as a virus, has a particular affinity with the heart and the heart muscle. So diseases that were fairly more rare before, like myocarditis, which is just an inflammation of the viral infection of the heart muscle, pericarditis, myocarditis, we saw them more often. And as a consequence of that, also we saw more arrhythmias, which means basically the irregularity of the heart rhythm that would develop during the acute infection and even as a late effect. One more thing also very important is that the virus seemed to have a particular affinity also for the nervous system. And as we know, the nervous system controls all the organs, and particularly with the heart. So some of the diseases that we saw before, like for instance in younger population, like orthostatic hypertension or other things that we give this sign, like POTS, P-O-T-S, postural orthostatic tachycardia syndrome, big name to explain this type of disease when this young patient, usually young patient, when they sit down for a while, when they stand up, the heart starts racing like crazy. We've seen that before. Well, after the pandemic, we saw it much more frequently than before.
Wow. So as a cardiologist, do you still recommend people to get the COVID vaccine?
Oh, that's for sure, yes.
Yeah. Do you find that in your time on Staten Islanders have become more aware of their heart, taking better, or trying to take steps to better their heart health?
Well, I would say that there are some improvement, but there's still a long way to go. There's still a lot of improvement to do, and they have to do with different aspects of, and some of them are difficult to fix because of the nature of our island. So, of course, proudly so, there are tradition also in the way we eat, in the way we. In the way we eat, and for instance, I mean, of course, me being Italian, I have this big understanding that pasta becomes like the goal. I mean, that you eat pasta every day and so on and so forth. Carbohydrates, I mean, bread and pasta. So yes, they were still too frequent, and oftentimes they can affect some of the risk factors like developing of diabetes and so on. And the sedentary lifestyle, as I was mentioning before. And why is that? I mean, Alex, you helped me understand this. But the island, I mean, we drive everywhere, right? There's maybe less walking around than in other borders, for instance, and so on. And that probably plays a factor. But also there is probably a lack of education on the importance of certain easy steps to improve our cardiovascular health.
Yeah, and you would think as the borough of parks, with so many parks around, that people would take advantage of that. But yes, it's true. You do see people now, there's 3-4 cars per house because people just need to get it around. But what would you recommend? What is the most effective thing that people can do to protect their heart?
So first and foremost, we have to understand what are the easy steps that we can do. We're not asking anyone to run marathons, okay? I mean, we ask if they want to, and then it's a good thing. But really, there are plenty of studies showing that a 20 minutes walk a day, a 30 minutes walk a day makes a big difference. So education on physical activity, being active, deciding to maybe park the car a couple of blocks down the road and make a walk to get to the store, or you know, putting in your daily routine. Okay, I'm going to spend this half hour doing a little bit of a walk. I don't know, at 8 to 8:30 in the morning, or during my lunch break at work, or something like this. That will change tremendously. Now, in terms of diet, there's a lot of talks about what is best food, what is I mean, I'm sure a lot of people of you are familiar with internet and so on. You can find everything and the opposite. Yeah. And recently also the reverse pyramid. I don't know if you heard the RFK reverse pyramid. Yep. I mean, the idea is that what we are promoting is to eat real food, and so try to avoid processed food that goes from sodas to to canned food, to any type of processed food, and try to promote real food. That can be a steak, that can be a chicken, that can be milk, that can be cheese, but everything that is, of course, together with vegetables, which is, but vegetables, we always say vegetables are good. Nobody ever complained about vegetables.
And fruits, yeah.
But even in the other things, everything with moderation, but real food.
And since you mentioned it, how many marathons have you run, Dr. Rotatori?
I don't know. I just think about the next one. No, I ran 15 marathons, 12 New Yorks.
Wow, 12 New Yorks.
12 New Yorks.
What's your best time?
My best time was 3:04 back a few years ago.
I'd still be on the Verrazano Bridge.
Yeah.
All right, we've closed this segment. Following a heart attack, heart surgery, or other heart problem, cardiac rehabilitation is a medically proven, effective way for a person's recovery. After this short break, Dr. Rotatori will introduce us to an innovative new program at RUMC that's providing people with the full benefits of cardiac rehabilitation right from the comfort of their own home.
Your life sounds pretty great. Don't let a buzz ruin it. Buzz driving is drunk driving.
We're back on RUMC Vital Signs. In partnership with Move In Health, RUMC is now among the first on Staten Island offering at-home cardiac rehabilitation to qualifying patients. Designed as a 12-week program, RUMC and Move In Health track each patient's activities and progress, making changes based on the information collected. Dr. Rotatori, tell us how this program works.
Okay, so I'm very excited to talk about this program because I think has a potential of having a huge impact in our community. So just briefly, first, what is cardiac rehab, right? As you mentioned, after a cardiovascular event, would that be like a heart attack or a diagnosis of heart failure or a heart surgery when one of these valves have to be fixed, like the mitral valve here, then there's the tricuspid valve on this side. I think I don't see. Let me see. Oh, no, this is the aortic. Oh, no. This is on the right side. This is the pulmonic valve. And then behind it, there's the aortic valve. I don't know. We can see it very well. Anyway, so after one of these episodes happens, we now know that it's very important to help the heart regain strength or so. And so for many years, cardiac rehab has been known to be beneficial. However, cardiac rehab has its limitation because what is cardiac rehab? What has been for traditionally is a place, a gym, let's say, a gym where patients go and under medical supervision with an EKG on you, they can start doing exercise and build up their confidence doing exercise. Now, the problem of that is that we can't, as an institution or other institution, we can't open 20 gyms to help people, based on their location, where they live or so. So we do have a wonderful cardiac rehabilitation brick and mortar program in our hospital, in the building right behind the hospital where all our rehabs are. Problem is that we noticed for many years that some of the barriers were, transportation and distance from home. So a couple of years ago, we started to work with this company that does a home cardiac rehab. And how does that work? So basically, they mail to your house, once you're enrolled, they mail to your house a scale, a blood pressure cuff, and one of these watches that monitors your vital signs, heart rate and saturation of oxygen and a few things. Based on your history, then virtually, even through WhatsApp or through the website, Zoom call or anything, you meet with a medical professional, with a cardiovascular professional, who basically takes the intake, finds out what your problem has been and what you need, and build, together with an exercise physiologist, build a program for you to follow. And you follow the program, you wait every day, you check your blood pressure every day. The information from your watch, they go straight to the website. And at that point, you can follow the progress also with multiple visits, virtual visit with a team that is following you. And by the end of the 12-week, you have, we as a physician, we were given a very, very extensive report in which it tells the progress that has been made and so on. So basically it mimics the brick and mortar. It avoids the disadvantages of having to move to a location, to a specific physical location. And it's a wonderful, wonderful program.
And how many people enroll in the program now?
We are on I mean, 30, 40 patients that are really enrolled and are actively working on the program. But we're hoping that in the nearest future, we are opening up to all our heart failure patients. And so we're hoping to hit 100 very soon. And
just the selling point of being able to do it in your own home has got to be a boon for everybody. It is. There is still, I mean, a few people that might really want to go physically and they don't live too far away from the hospital and they want to do it. But we have noticed that the people that have they have completed the program already, they really swear about it. They're very, very happy about the program. They found tremendous benefits, and it's smooth and only good things about it. For more about the at-home program, call 718-818-7425. Unfortunately, myths about heart health keep too many people from getting the care they need. Next, we put some of the most common beliefs to the test. Myth or fact? Stay tuned.
Look at that. It's so sad.
Welcome back. If you're wondering what information you can truly trust when it comes to your heart, you're not alone. In this segment of Myth versus Fact, Dr. Rotatori will help us break down common heart-related myths and share facts backed by medicine. So I guess we can start with the first one right off the bat. Myth or fact, heart disease only affects older adults?
All right, that's a myth. So the heart attack is basically a buildup of plaque, of cholesterol buildup in an artery, one of these arteries that are surrounding the heart. And the buildup is going to eventually close the artery. So the whole entire muscle that is distal to this artery is going to suffer and is going to die, creating a scar tissue. So that process starts in the childhood. And unfortunately, given the risk factor and it's like diabetes, high blood pressure, and high cholesterol, and smoking, and as we spoke about before, that the progression of the disease can be very fast in some unfortunate patients. And so the disease can come very early. And actually, I have to say that we have seen, I mean, there's no evidence, but I've seen a trend in younger patients having this type of disease lately.
Which actually leads us to the next myth or fact question. Myth or fact, if your cholesterol numbers are good, it means your heart is healthy.
Oh, well, no, unfortunately, no. I wish it was that easy. So the short answer is that we don't know enough to answer that question.
Okay.
But so it's a myth. What it means is that if we take 100 people that they have high cholesterol and 100 people that have low cholesterol, there's going to be more people in the one that have high cholesterol that they're going to have heart disease, and less people that in the low cholesterol group that is going to have disease. However, some people here, they're not getting the disease, and some people here, despite having good cholesterol, they're still going to have the disease. And why is that? So the problem is that, again, we don't know enough, but we were learning more and more. And there are new tests now that are coming out to understand better. But genetic factors are also interfering with the fact that despite your cholesterol level, you're going to be more prone to deposit cholesterol in the arteries, or the cholesterol is going to just circulating and the arterial wall remains clean. There are genetic factors, there are predisposing factors, and that's where the research is going. We're pointing towards what we call the precise medicine, individualized medicine based on your genetic predisposition.
Gotcha. This next one might be a little easy, but myth or fact, shortness of breath, nausea, fatigue, jaw, neck, or back pain can all be possible symptoms of a heart attack.
Yeah, that's a fact. And those are what we call like the atypical symptoms. I mean, the elephant sitting on the chest is like the typical symptom, but all these other ones, they can actually present they can actually be the sign of a heart attack. And one little caveat also, more common than not in women.
Oh, okay. Myth or fact, heart disease is primarily a health issue for men.
Well, I'm glad you asked right now. That's perfect. That's, of course, is a myth. Heart disease is the #1 cause of death for men and women. And unfortunately, it's also true that maybe also because of what I said before, once you get a heart attack, unfortunately, women seems to do worse than men. Maybe because the detection of the heart attack in women, it's a little more complicated based on the atypical symptoms that develop.
Myth or fact, people with heart disease should avoid exercise.
Well, that's what we spoke about today. That's definitely a myth, and that's a bad myth. So everyone that had heart problem needs to exercise, and needs to exercise in the correct settings, need to exercise with the right program. But by all means, sedentary lifestyle is gonna worsen the disease of your arteries.
Myth or fact, conditions like high blood pressure and coronary artery disease can develop silently for years without any symptoms.
Yeah, that is a fact. So for high blood pressure, I mean, in fact, high blood pressure is considered the silent killer. That's how it's defined. What it means is that you can have high blood pressure for years and have no symptoms of it until starts developing the late effect of the disease, which sometimes they can be very, very problematic, and so it's kind of too late to find out. So good prevention becomes very important. And coronary artery disease, as I said before, the process of buildup of cholesterol in the arteries, it's a process that starts basically the day you're born. So for many, many years, no signs of it, and then unfortunately a dramatic event can develop.
And our last myth or fact, once heart damage occurs, nothing can be done to improve the person's cardiac health.
Well, that's a myth still. I mean, despite the fact that the scar tissue that I was talking about before, once it's generated, is very difficult to get rid of. I mean, it's interesting here because this goes back to the first question of today. I mean, what did I do when I did my basic science research? I was studying the possibility of using stem cell to regenerate the heart muscle, but that hasn't got to the clinical application yet. So that's a hope for the future. But in the meantime, the heart is a fantastic, amazing organ and has an ability to compensate to problem. That compensatory, so basically, if this area is not working well, the other areas are going to push harder to compensate the lack of function of one part of the organ, of the muscle. At that point, really, it's where taking care of your risk factor and exercise can help strengthen the heart.
When we come back, we'll take a look inside of the Joan and Alan Bernikow Heart and Vascular Institute that'll be opening later this year at Richmond University Medical Center. Later this year, Richmond University Medical Center will unveil its newest specialty care unit, the Joan and Alan Bernikow Heart and Vascular Institute. This $11.5 million institute brings RUMC's cardiovascular and neurovascular services together in one unit. Expanded preoperative and holding bays, a refurbished family waiting and reception area, and the latest medical technology are just some of the exciting features of this new unit, named for Joan and the late Alan Bernikow, longtime Staten Island philanthropists. At the center of care within the institute is biplane imaging technology. Dr. Rotatori, can you explain to us what is biplane imaging technology?
We're very excited to talk about this because as we all know, it's better to have images in 3 dimensions than have images in 2 dimensions. I mean, it's nicer to meet someone instead of seeing in the picture, right? That's what it is. Well, the same thing happens for us. So to quick explanation, and this can apply for the heart, we can apply for the brain, and we can apply for the vessels in the legs, so peripheral vascular disease. When we are taking pictures to understand if there's a blockage in an artery, the way we do it is that we use an X-ray machine. The X-ray machine takes an X-ray and takes multiple X-rays that they create a motion image, a motion picture. So We inject contrast. The contrast comes from a catheter that we insert on the wrist. The catheter comes up through this vessel here, comes down, and then it sits here where there's the opening of the coronary arteries. We inject contrast. The contrast fills the arteries. Of course, when we are taking pictures maybe front back first, so this way, so we see the artery this way. But then we have to go this way to see it this way. So then we have a full view of the artery. I mean, the disease, the plaque can build up in this way.
So you can see the blockages and everything.
There's no, sometimes some particular case, the plaque is so eccentric, so it's only in one portion of the artery that maybe in this way we don't even see it. But when we look this way, we see it. Now, the biplane machine has two X-rays that are perpendicular to each other, and they take simultaneously images. At that point, when we inject contrast, what we see is not anymore just a simple image front and back, but we see a three-dimensional picture. This has been proven to be particularly beneficial for neurointervention, intervention in the arteries in the brain. Like if you have aneurysm, if you have some bleeding, if you have a stroke, because the anatomy of the brain is very convoluted, and having the ability of seeing in 3D makes a huge difference. Same you can say for the vessel in the legs, and partially for the vessel in the heart. So that's what the biplane is.
And this new institute is just going to basically revolutionize everything in your department as far as care here
Well,
on Staten
absolutely.
Island.
I mean, first and foremost, we also had focus on the patient care, and so we will have a brand new recovery area where a patient are coming before and after the procedure that will improve significantly their comfort. But also, we'll add a second lab, so will allow us to do more procedure, and the biplane will allow us to do also more precise and more complex procedure. So.
Just the latest development here at Richmond University Medical Center, and no doubt the new institute will reinforce RUMC's message to the community that quality health care is right here on Staten Island, close to home. When we come back, we'll wrap up this heart-focused show with some quick tips from Dr. Rotatori.
If you smoked, get scanned. Talk to your doctor or learn more at savedbythescan.org.
As we come to the end of our episode, it's only fitting that we let our guest have the final word. So, Dr. Rotatori, what are some last parting tips you can give to our audience?
Well, I mean, to conclude on everything that we said, I mean, and going back to what I said before about education, be familiar with what really needs to be done to protect your health and to protect your heart. Exercise 150 minutes a week, which means 30 minutes 5 times a week, 50 minutes 3 times a week. That's perfect. Check your blood pressure. Be aware of your diet, low salt diet I mentioned before, to check your blood pressure. And once you control your blood pressure, once you control your cholesterol with a good diet and exercise and maybe medication if needed, you're already 60% of the way. And so, yes, take care of yourself.
Thank you, Dr. Rotatori. If you'd like to schedule an appointment with Dr. Rotatori, our cardiovascular department, it can be reached at 718-818-7425. Dr. Rotatori's office is located in the Dr. Krishna Urs Medical Pavilion at 1161 Victory Boulevard. For additional heart health information, you can visit our website at rumcsi.org or follow us on Facebook, LinkedIn, Instagram, and X. Richmond University Medical Center has cared for Staten Island for over 120 years. You can help ensure that care continues by making a financial contribution to the hospital. To donate, visit our website and click on the donate button located at the top of the homepage, or you can call 718-818-2106. That just about does it for this episode of RUMC Vital Signs. Thanks for joining us. I'm Alex Lutz.
This program was produced through the facilities of Community Media of Staten Island.